So, nursing is responsibilities. So, when you say nursing responsibilities, nurses create nursing care plans. Then, in this patient, the chief complaint of this patient is dizziness and hematuria. So, the first NCP is here in the assessment cues is the objective cues are patient verbalize a pain scale of 7 out of 10, facial mask of pain, elevated blood pressure, restlessness, and reduced interaction with people and environment. So the nursing diagnosis that was formulated from the objective cue is acute pain related to disruption of skin and tissue integrity, as evidenced by patient verbalization of pain from 7 out of 10. So, each nursing diagnosis has a scientific basis on why they come up with that diagnosis. Here, the post operative wound from a C section delivery may feel sore for a week or two in it's because the muscles surrounding the wound may also feel weak. It is common to feel pain at the site of the incision. Many women also feel post-birth cramps as the uterus shrinks. So next is the outcome identification. So here is the goal and desired outcomes in which the goal is to reduce pain. So, the desired outcome is that after 5 to 6 hours of nursing intervention, the patient will be able to report pain is reduced from 7 to 4 out of 10, follow prescribed pharmacological regimen, describe relevant methods to facilitate pain control, and lastly, verbalize a sense of control of response to acute situation. So, the nursing interventions that are mostly done to achieve the goals and outcome of identification, in which each intervention has its own rationale in why they do this. So these are the different interventions from independent, dependent, and collaborative interventions that are done to achieve the goal and desired outcomes. Lastly, when these interventions are done, comes with a evaluation in which the patient verbalized that pain has reduced from 7 to 4 out of 10. Next, the second NCP is that objective cues is elevated blood pressure with 140 to 140 over 100, then pitting edema 4 millimeters, 2 positive on both lower extremities. So, nursing diagnosis that was formulated based on the objective cue is decreased cardiac output related to hypertension as evidenced by elevated blood pressure. And the scientific basis is that most people diagnosed with hypertension are treated with antihypertensive medication in addition to lifestyle modification. So the outcome identification in this second NCP is goal is to reduce the blood pressure. Then desired outcome is after 5 hours of nursing intervention, patient will be able to maintain blood pressure within normal limits, maintain pulse steady and within 60 to 100 beats per minute, demonstrate unlabored breathing, and demonstrate absence of dizziness or confusion. Next is the nursing interventions that are mostly done to reduce the blood pressure and is related to blood pressure. Here, different nursing interventions from dependent interventions, dependent, and lastly collaborative. When these interventions are done to minimize or lower the blood pressure, here comes the evaluation in which the goal was met. Then patient will be able to demonstrate signs of adequate blood pressure. Next is the third NCP is Objective cue is patient expresses pains, difficulty in moving, verbalizes pain when mobilizing, limited or no ability to move without assistive devices or significant others. So the nursing diagnosis that was formulated was impaired mobility related to post-operative wound as evidenced by pain at the incision site. So the scientific basis for this diagnosis is a C-section is the surgical delivery of a baby that involves making decisions in the mother's abdominal wall and uterus. As with any surgery, there is usually some degree of pain and discomfort after a C-section. So the outcome identification is this. The goal is to enhance mobility and promote safety. Desired outcome is after 5 to 6 hours of nursing intervention, the patient will be able to perform physical activity independently or with assistive devices or family. Verbalize different techniques to enhance mobility and demonstrate ability to move around unaided with safety. So these are the nursing interventions that are done to help patients' mobility. And then here comes the evaluation after the nursing interventions are done, where the goal was met. Patient demonstrated enhanced mobility with the promotion of safety. So the fourth NCP is the objective cues is primipara, age not ideal for gestation. So the nursing diagnosis is that deficient knowledge related to unfamiliarity to situation as evidenced by primipara and age. So the scientific basis for this diagnosis is some C-sections are of medical reasons in the mother's health and in the baby. Emergency C-sections can cause anxiety, especially to first-timers in pregnancy that have limited to no knowledge about pregnancy. So the outcome identification is goal is to cope up with the current situation and enlighten the patient about pregnancy and C-section delivery. The desired outcome is after 5 hours of nursing intervention, patient will be able to verbalize familiarity to the situation, apply acquired knowledge information to the situation, and demonstrate a change in behavior due to acquired knowledge. So these are the nursing interventions that are done in this and in this fourth NCPs to help the patient. Then the evaluation is the goal was met, patient verbalized familiarity and knowledge to the situation. So the fifth NCP is that the objective cue is post-operative incision. Here, the nursing diagnosis is risk for infection related to post-operative incision from cesarean delivery. The scientific basis is that surgical wounds can become infected by germs that are already on your skin that spread to the surgical wound. Germs that are inside your body or from the organ on which the surgery was performed. The outcome identification is that the goal is to increase healing time and remain free from infections and further complications. So desired outcomes is after 5 hours of nursing intervention, patient will be able to remain free from signs of any infection, demonstrate ability to perform hygienic measures like proper oral care and hand washing. A patient will be able to demonstrate ability to care for the infection-prone sites, and lastly, verbalize which symptoms of infection to watch out for. So these are the nursing interventions that are done to avoid infection, to help patient avoid infection. And then here comes evaluation, which the goal was met. Patient will be able to demonstrate signs of adequate blood pressure. So here comes the discharge plan. So discharge plan methods was done. Here the medication in M the medication which antihypertensive, like 30 milligram nifedipine, 250 milligram of methyldopa, 25 milligram of captopril was given to the patient in which is prone to high blood pressure. Then antibacterial medication was given to the patient, which are the 500 milligram efenamic acid, 500 milligram of cefuroxime, in which it is to avoid bacterial infection. And then lastly, ferrous sulfate was given to the patient to to because patient was iron deficient. Then in E, the exercise advise patient to acquire adequate amount of rest, then avoid strenuous exercise but do gentle walks, then suggest yoga or any stretching exercises. In treatment, instruct that regular perennial care should be practiced and maintained, especially to the patient. Explain to the patient to eat more vegetable while breastfeeding, imparts flavors in the breast milk. So, and then encourage to practice daily water intake of at least 3 liters. Advise to take prescribed medication unless side and adverse effects occurs. Then in health education, educate the patient to do not drink alcohol or smoke. Educate the mother about what she have experienced. Inform patient that current age is not ideal for pregnancy and provide information about family planning. Then in outpatient or inpatient referral, emphasize to the patient that she will need follow-up checkups to monitor postpartum. So in diet, educate the client or the patient to eat foods that are nutritious and healthy. Educate the patient that a lactating mother needs more calories during breastfeeding. Encourage the patient to eat more foods that contain protein, calcium, and advise them to avoid caffeine. And then in spiritual support, encourage family involvement for provision of comfort and emotional support. So the next method that was used in the discharge plan was the bubble lash. In breast, advise patient to wear well-fitted bra that isn't uncomfortable. Recommend to wash breast with water daily. Explain patient to let his or her nipple air dry after each meal. Advise patient to apply a few drops of breast milk while after a feeding and let air dry if nipples are sore to soothe the breast or apply lotion. Now, if breasts are engorged, tell patient to apply warm compress. So in the uterus, explain to the patient that postpartum pains or cramping are normal. Inform the patient that it takes 5 to 6 weeks to return to its non-pregnant size. In bowels, advise the patient to take short walks in which this promote bowel movements, passing gas, and increase general circulation. Then encourage the patient to lift his or her foot onto a stool after a bowel movement to reduce straining. So in the bladder, inform the patient that conception, labor, and vaginal delivery allow the pelvic floor muscle, which protect the uterus, bladder, small intestine, and rectum, to stretch or be injured. This might cause to leak a few drops of urine while sneezing, laughing, or coughing. Let patient understand that this problem usually improves within the week. Then, advise patient to rinse and clean perineal area every time of avoiding to minimize infection. So in LOSHA, inform the patient that vaginal discharge usually lasts 10 days to 4 weeks. Then advise patient to visit clinic or physician if bright red LOSHA lasts more than 4 days. Then in episiotomy or lacerations, explain to the patient that the perineal stitches will fall out in 1 to 3 weeks. Teach the patient that to rinse from front to back with warm water until the bleeding stops. Teach the patient that in reducing discomfort by cooling the cut with an ice pack. In Human's sign, explain to the patient that elevating the feet while seated or laying down and drinking plenty of water will assist the body in eliminating extra fluid. And lastly, the skin. Educate patient that stretch marks are normal and will not disappear after delivery, but eventually fades from red to silver. Advise patient to provide adequate moisture to skin to avoid dryness, then apply lotion.